Central Guinea Pig Rescue.
Hi everyone. We have got, this is bedding that's being used, and by the way, I absolutely love this bedding. This is the best bedding ever. I've moved off fleece and we use these. They're called bubble mats or toggle mats, and they literally, anything that comes onto there like hay or other debris, you shake them, it just goes away. It's so easy. There's no brushing and combing like we do with fleece. And they're so absorbent, it goes through to this bottom level with a piece of toweling underneath it. It's just fantastic bedding. But that aside, we've got some piggies that we're going to look at now, but this spotting has been noticed on the bedding, and people often ask what sort of spotting is serious, what should you look for? Well, this spotting here, you can see it's very red and deep in colour, but it's also got a little bit of whitish. If we look over here, similarly, white, and this white generally it's calcium. It's calcium carbonate, it's an easy way to say it, being excreted from the body, and it looks like a white powdery substance when you see it in caging. And quite often, if you've got hay there, you may not notice it. So there's little bits of it around. Then we've got these patches here and here that look a little blood-like. Now, because it's dried, it looks today like oldish blood, but one of the differences that does help when you see something that looks like blood is noticing the colour, if it's bright red or if it's more of a dark colour. Because if it's bright red, it's generally fresh, and if it is darker, it's something more related to clotting. So yeah, that's fascinating. So let's have a look at the piggies and see if we can work out what's going on.
Here's Bella.
So who's this? Bella? Hello, Bella. So Bella, you said, has lost a bit of weight. Is that right?
Yes.
Yes, okay. That's
1.2.
yeah, she has. Okay. How quickly has she lost the weight?
I noticed in a couple of weeks.
In a couple of weeks,
Yes,
okay.
And because I used to weigh them monthly,
Yeah.
I feel her pretty okay. She's still eating, drinking.
Okay. Is she pooping normal?
Normal. All the poops are normal.
Produce one for us.
Yeah. Has she had any checks like scans or anything done with vets? No, not yet. Okay. If we look at Bella, see how around this opening there's also the matching crystallization, that's creaminess there. Now generally we see this when guinea pigs have calcium that's being excreted from the body. They can, as a rule, also have stones that are in formation. What I'm feeling now is the ureter, which is, it extends here from the base of the bladder down and out. To see if I can feel any stone, which I can't. There is a tiny, tiny lump in there. There is actually a tiny, tiny lump there, but nothing I would worry about. Her abdomen, let's have a look. She's not in any pain from that. Oh, that was, wasn't it? Yeah, is that sore? Okay. Yeah, so she has a little bit of pain on the right-hand side of the bladder area. Yeah, it's the same location just then. Okay, so that location, just to show you where, is right here. That was painful to her. Just going to carefully feel there. Okay. Yeah, okay, I got it. I got it. All right. What would be the best thing is a quick x-ray of her to see if she actually has a bladder stone. She has none that are in the ureter, and what happens with bladder stones, they can form and they can get stuck in the bladder where they can't come out, and it can, when they get large enough and they actually stop at the base of the bladder, the guinea pigs, then it interferes with their whole urinary process and they can die from that. But if they are able to pass them into the next area, which is known as the ureter, they can travel out and we can actually take them out, which is, you know, these are little stones, the ones that we take out regularly. So females have a higher chance of being able to pass them out. Now, when they do pass stones, particularly if they're a bit bigger, it can be painful and there can be blood associated with that. So she may have in fact passed a little stone, which could explain this here, or she may have more going on with that bladder in terms of a urinary tract infection. So the pain that she's got there, which is in this region here, so it's on this side, is sore to her. Certainly not in this position, she's not jumping. I'm just feeling very carefully for her. Hey, little one. Oh, I'm doing a poo. That's what we need.
Looks good.
It's a healthy poo as well. Well, it's a healthy little poop. I'm just going to press from the underside. Yeah, it's the same place every time. It's just literally, my finger, if I was to go directly from my thumb down, it's directly on that right-hand side of the lower bladder, is painful to her. So,
How did she react to when you pressed?
that area,
Yeah.
just then, she's like a it's like a little high weak, yeah, very painful to touch.
And I was actually
So,
filming her face.
Yeah.
And her face started to twitch.
yes, yeah, it's painful. So she has, now, she does have that, yeah. So let me feel that, little girl.
By the way, she's quite old.
How old is she?
She's about 6 years old.
Is she? Wow, okay.
She's in beautiful condition.
Oh, is she? She came
Apart
from
from the painful bit.
She's from Queensland.
Okay.
Yeah, she actually has, she does have a lump in here,
Oh, poor girl.
but I don't believe that's, it's just here, it's under, it's actually almost to her knee. Can you see where her teat is there? It's actually, it's here, it's moving up towards her leg, but I don't believe that has, yeah, I don't believe that is a lot to do with it. It's, let's let you down again and feel here. Good girl.
In particular, her breathing is
It's there.
sometimes so
Right, this is what I'm feeling. And if you can you come in with your finger and I'll show you where it's where this finger is here. I've got, can you feel that lump? It's a decent lump. It's a big, it's a marble, bigger than a marble maybe. That,
really
yeah,
big.
it's right there, and that is, no, it's down, it's this one here. Feel, no, move your finger down there, that. Feel that? It's really, it's decent. It's not, her knees over here, but you feel that, it's like tucked in there. It's massive. It's actually, where?
is here.
There, you're feeling the length of it. It's really quite big.
It's huge.
Yeah. It's bigger than a marble. I don't know if Suzanne, you can pick that up, but it extends from here to the top of where my finger is. It's decent. Like, and that is actually pushing right on the area that's sore. So I do think this is what is the issue. And hi everyone. Quick intermission. We have down below an Amazon wish list, which is another way that you can help support the wonderful work we do here at Cavy Central. Any items that you choose to click on will arrive here with us, and of course you'll see them featured in upcoming videos. So take a look at that list at the end of the video. We appreciate your support. Let's get back to the video. But it's enormous. It is tucked in here under her legs. So I think that is connected to it. And as she's got that hidden away in there. The only way we will know fully is to rule out, firstly, stones. She's got some calcium deposits there, but I can't feel anything in the ureter. But she does have that lump that's up higher. That could be causing perhaps more of a bladder-based infection with it being there, and hence the calcification coming away. I think they're related somehow. They're related. We need to have eyes on the inside, really.
Yeah, an X-ray won't pick up that soft tissue.
An X-ray is amazing, actually. They do pick up fluid and things, even though we think of them as showing just bones. When they have, for example, ovarian cysts, they can actually see fluid sacs in there. So they do reveal a lot. And because vets often have digital X-ray today, which is really quick and easy to do, that can be a quick process. So I think an X-ray would be the thing I'd recommend for her, so we can see exactly what's going on. But I have found with, yeah, I don't feel if it's that lump there. When you go, you feel it underneath, it's really, yeah, it's very obvious now. It's massive. It is massive. Let me see this side, sweetie pie. You know what? She's got the same over here. She has exactly, she's got a massive one there. Massive. Two. She has two there. She has two massive ones there. Okay.
Symmetric, darling.
No, not symmetric, but she actually has, what is going on with you there? Yeah, massive, massive one here that, it's right there between my fingers. It is massive. Right there. So she, right all, you can see I'm holding it. This is not her knee is back there. She has a massive lump there. So, okay, with that in mind, I think that whatever those masses are, it is impacting on that region, which is the bladder region. An X-ray would rule out any stones. The simplest way, and it wouldn't be covering what those lumps are. It wouldn't actually be finding out what they are. But an antibiotic would get on top of any bladder infection from the positioning of those lumps. It wouldn't change what those lumps are, and I suspect they're probably maybe even tumours, in the sense that they're really unusual, very unusual.
So you'd need a needle biopsy
Yeah, but
to tell what they are?
I mean, that's really extensive, because even if you look at surgical intervention, that is enormous. It's here to here. It's now, like, it's quite mobile.
It's as big as a ping pong
It's
ball.
big, it's
almost.
there. I wonder if she's even hiding away. Because the other one is actually located way up here on the outside. They're not ovarian cysts, but the other one is here. See, it's on the abdomen? It's there. It's way up here. Can you see that? And it extends down to there and all the way up and over. It's like a massive lump. This one is, sort of feels like it's two parts, but it's the same, because it goes almost from, yeah, it goes right up and round right here. So she's got two enormous masses in there. They're not ovarian cysts, which are in a slightly different location. She's a really interesting guinea pig. Yeah. Do you think it's her that's been making the blood patches, or do you think it's the other one? Because I'll be interested to see the other one.
I cleaned, first I thought it was her.
Yeah.
I cleaned her
Yeah.
straight away.
Okay.
with Wipes. Didn't find anything
Yeah.
in the blood. And then we put her separate to
Mm.
see if she actually did it.
Okay.
And she didn't have anything.
The other one didn't
Yeah,
have
the other one
anything.
didn't.
What about this one?
She didn't have anything.
Either.
There's been no new marks since
Yeah,
that day.
since that day.
Yes,
I'm sort of the mind that could have been a little stone being passed, because I can feel a tiny little one in the ureter, which is down in here. There's like a
There's
little
another
tiny.
one too.
No, I don't think it's nothing you need to worry about. There's a little bump in there. And it's not like that would be easy. It's not that bump I'm talking about. But there's a little tiny area down in there, but I wouldn't worry about that, because I think she can pass that okay. I do think though the bigger issue are these lumps. That they're massive, they're really enormous, particularly the one on the left side is bigger than the right and extends right back up here into the side of her. So yeah, surgically to remove those, they could look at doing that, but they'd want to know first what they're dealing with, and that comes from, you know, we'd do, in that sense, they'd probably do an ultrasound to really see. She's gorgeous. I think the first port of call is to see which one is causing the blood. It wouldn't surprise me, given the calcification on her area down below, if it came from her. And an antibiotic would easily get on top of any bladder sludge that's there to calm that down, but it won't do anything for those massive lumps that are there. So she's got a lot of abdominal issues going on. Hey, have you clicked on the subscribe button below? Please do that now so that you can also see our upcoming videos and others will also get to find them.